Now, in the email, it said that we needed true health care reform. Now, I looked at that and I thought, we need to define what true health care reform is. Now, I lived in France for 10 years, 6 years in Paris and 4 years in southern France. I want to paint you a little picture of what's going on in France. France can cover 99% of their inhabitants. They also make sure that whenever there is a serious illness like cancer or diabetes or heart disease, 100% of their medical bills are paid. They also have a very envious long-term disability and retirement program. And if a woman becomes pregnant, all of the prenatal care is paid for. They have 6 weeks off prior to delivery, 10 weeks off after delivery. That's just for the first baby. And all of the programs after that are subsidized. But the one thing that they do, and this is law, is all French workers have to take 5 weeks paid vacation. Now, how can they do this? How can they supply 5 weeks paid vacation, 100% coverage when you had a catastrophic illness? How can they do all these other programs and it costs half as much as ours? It's because we have investor-owned healthcare system and the market determines who gets care, who doesn't, and that is wrong. We need to change that, and we need to have the French system, I believe. So here's what I'm proposing. I think that we should have one financing system that dedicates funding exclusively to medical care and services within a fair and regulated budget. They do that in France, they do that in Holland, they do that in Germany, Italy, Portugal, and they even do it in the small country of Switzerland. And you don't have a great big pool. They have a budget. It's called a budget. You don't go over. So, for example, in Bellingham, you could be charged $5 for an aspirin. I think in Seattle here it's $8 an aspirin. I know for a fact that hospitals will also charge $15 to $25 for a box of Kleenex. And you wonder why healthcare costs so much? Also, Americans pay the highest drug prices in the world. When I'm in Congress, what I'm going to do is take away the direct-to-consumer ads that are illegal in all the other countries. I can go across the border into Canada and buy some drugs 20 to 90% cheaper because in Canada it is illegal to have direct-to-consumer ads. We are the only country except for New Zealand who still does this. That's what I would do. I would also make sure that there is equal access, equal care. I don't think that a congressman from any state is better than I am, and I don't think that they're more deserving for any more care than I am or you are. And I think that this person here should have the same coverage as that person up there, all across the board. Equal access, equal care. That's what I'm about. Back in the 1930s in France, they had the same situation then as we have today. They had HMOs coming in and saying, Mr. Doctor, you are not allowed to prescribe this therapy. The doctors got pissed. And they went out and protested. And when I lived in Paris, I just hated the fact that there was a protest every day. But you know what? I would do it now. I would. But here's the thing. Here's what the doctors did. They went out and protested, And now it is against the law for any third-party agency, government, or insurance companies to interfere with a doctor's sovereignty to diagnose and prescribe therapy. We need to have that law here in the United States so that we can't have any more administrators or insurance claims adjusters trumping what the doctors have already learned 10, 12, 14 years in college. So we need to have that law. And like Donna said, we can't wait for change anymore. We just can't do it. We have to make things happen right now. And the thing is, we have to stand up. And I know a lot of you have already stood up. You've been in the streets. I know that because I was right beside you. But the thing is, we are going to have to stand up and raise our voices. Because when we raise our voice, we also get nerve to raise it a little bit louder. And then when we raise it a little louder, somebody else finds their voice. And then the next thing you know, we have a whole community out there raising their voice. That's what we need. We need to stand strong when it comes to equal access, equal care. We need to stand strong when it comes to getting the insurance companies out of our doctor's offices. We need to stand strong when it comes to health care as a right. We need to stand strong together because this is our home, this is our country, and I hope that you will support me in my effort for Congress. Thank you.